Good afternoon, NAAOP members and friends. I'm Peter Thomas in Washington, D.C., General Counsel of the National Association for the Advancement of Orthotics and Prosthetics. Big news recently has been the announcement of a physician documentation template or a clinical documentation template that the Centers for Medicare and Medicaid Services are planning to develop and implement in the near future. That will assist physicians in recording what they consider to be the proper medical and related information in order to justify coverage and payment of lower limb prostheses. In fact, CMS held an open door forum in late May. NAAOP participated in that open door forum by conference call along with a whole host of others. We actually alerted our members to the existence of that open door forum and hoped you participated in that. The template stems from a long-standing 20-month campaign that CMS has undertaken to try to clean up physician documentation of orthotic and prosthetic claims, in particular lower limb prosthetics. And this really stemmed from the publication in August 2011 of a OIG report entitled Questionable Billing for Lower Limb Prostheses. Soon after that report was issued, CMS also issued a Dear Physician letter where it laid out what it considered to be the standard for documentation in medical necessity of prostheses, lower limb prostheses. And they basically said that the physician's files, the physician's clinical records, are the only thing that matters, not the prosthetist files. That's not correct Medicare law in our view. There is a legislative history and a regulatory background that clearly establishes that the prosthetist's files are in fact part of the medical record. But CMS has not yet explicitly stated that to that effect, and ultimately that has caused tremendous problems across the country with respect to Medicare contractors auditing prosthetic claims. The NAAOP has worked very hard over the last 20 months, along with all of the members of the Orthotic and Prosthetic Alliance, in working with CMS, OIG, the General Accounting Office, and Congress to try to correct this problem and try to figure out a way that claims could be submitted to Medicare without being recouped, without being audited to such a significant extent, and in such a manner that clean claims could be paid and providers could rely on those payments remaining in their accounts and not having to be recouped. The most recent attempt by CMS to address this issue is this physician clinical documentation template. NAAOP has no problem with defining exactly what CMS is going to expect in order to file a clean claim, but we do have pretty significant problems with the way this template seems to be emerging. In particular, the template really is heavily focused on physician documentation. It's strictly geared toward a physician filling out medical forms and filling out his or her own files to justify medical necessity. It really bolsters and supports the fact that the physician's files are the only files that matter, not the prosthetists, and we have a major problem with that. We believe the template, if they're going to use a template at all, ought to be in part related to having the prosthetist fill out those elements that dictate or that assess functional status and functional potential, and then allowing the physician to do, of course, the medical review and record documentation accordingly. Unfortunately, the template is something that really does not need to be implemented. CMS has plenty of levers that it can pull to rein in the kind of overutilization or to improve clinical documentation simply by implementing the BIPA Section 427, which was passed in 2000. That's the Benefits Improvement and Protection Act. And that was never implemented. And that is the law that links Medicare payment with the qualifications of the practitioner or supplier providing custom orthotics and prosthetics. CMS has not ever implemented that law, and it should. In addition, CMS really ought to clarify explicitly that the physician's files are fine, but the prosthetist's records are part of the medical file for determining medical necessity. That's what we're going to continue to argue to CMS and try to improve the documentation template to the maximum extent we can, if in fact CMS intends on moving forward with that template. Finally, let me just say that June 13th at 4 o'clock Eastern Time, CMS will be hosting a second open door forum on the clinical template, and we urge you to participate in that conference call. You can find out more information on the NAAOP website. Thanks so much.